Okay, let's talk about something that's super common but can also be kind of confusing and, let's be honest, really uncomfortable. Vaginal yeast infections. In this explainer, we're going to cut through all the myths and just give you a clear, straightforward guide to what's going on and, most importantly, what you can do about it. So let's just get right into it. Have you ever woken up with that dreaded feeling? That unmistakable, uncomfortable, itchy feeling where you just know something is off? It's the worst, and it can totally throw a wrench in your day or even your whole week. If that sounds even a little bit familiar, the very first thing you need to know is you are absolutely not alone. This is a really common health issue, so there's no reason to feel embarrassed or like you're the only one dealing with it. Millions of people go through this. All right, so let's get into the specifics. Before you can get relief, you got to know what you're actually looking for. So let's break down the most common signs of a yeast infection. The symptoms are usually pretty distinct. We're talking about a really intense itch or even a burning sensation. You might notice some redness or swelling. It can also be painful, especially during urination or sex. But the classic telltale sign for many is a thick white discharge that people often say looks like cottage cheese. All of that just adds up to a general soreness that's pretty hard to ignore. So what's the medical term for this? It's called vulvovaginal candidiasis, or VVC for short. It's basically a fungal infection, and it's usually caused by a type of fungus called Candida. Now, here's a really, really important point. This is not a sexually transmitted infection, or STI. Some symptoms can feel similar to STIs, sure, but a yeast infection is something else entirely. So, you've got the symptoms. You're pretty sure you know what's going on, and now you're at a fork in the road, facing that first big decision. Do you try to handle this at home, or is it time to see a doctor? And this really lays out your two main options. On the one hand, you've got all the home remedies you hear about. Yogurt, garlic, things like that. They might give you a tiny bit of temporary relief, but there's just no scientific proof that they actually cure the infection. And the real risk? You're delaying treatment that actually works. On the other hand, you have medical care. This gets you a real diagnosis from a professional, access to proven antifungal meds, and maybe most importantly, peace of mind that you're treating the right thing. And this quote from our source material really just nails it. While some of those home tips might feel a little soothing for a moment, it's the treatments you get from a clinic that actually heal the infection and give you real, lasting relief. Okay, so let's say you go the professional route. What can you actually expect? Let's walk through the proven path to getting relief and getting it fast. The whole process is way less intimidating than you might think. It's actually really straightforward. First, you'll just talk about your symptoms with a provider who gets it. They might do a quick, simple exam or take a swab just to be 100% sure it's a yeast infection. And then that's it. You walk out with a confirmed diagnosis and a clear plan to get better. Now, the treatment you get isn't just a one-size-fits-all kind of thing. The doctor's going to figure out if your infection is what they call uncomplicated, meaning it's pretty mild and you don't get them often, or if it's more on the severe side. And that difference is key to getting you the right medicine. So here's what that usually looks like based on the clinical guidelines. For a simple, uncomplicated infection, it's often as easy as one single pill of a medicine called Fluconazole. That's it. If the infection is more severe, a doctor might prescribe 2 or 3 of those pills, but you'll take them 72 hours apart just to make sure that infection is totally knocked out. And here is the absolute best part. Once you start that medical treatment, most people start to feel way, way better within just 24 to 48 hours. That's huge. It means you don't have to just suffer through it for days and days. Relief is actually pretty quick. All right, but let's tackle another big question. What if this isn't just a one-off for you? What if these things just keep coming back? It's so frustrating. But the good news is there's a solid medical strategy for this exact problem. For what's called recurrent VVC, the medical guidelines actually recommend a structured 2-phase plan. This isn't just about putting out the fire of the current infection. It's about breaking that whole frustrating cycle so it stops happening. Okay, so here's how it works. Phase 1 is called induction therapy. You can think of this as the initial all-out attack to get the current infection completely under control. This might mean a stronger treatment course, like a couple of weeks of therapy or several oral doses to really clear everything out. Then, after that, you move into phase 2, maintenance therapy. This is all about playing defense. It's a proactive, preventative plan where you'll likely take a low dose of that same antifungal pill maybe once a week for about 6 months. The whole goal here is just to keep the fungus from coming back and starting another infection. So, we've covered how to treat an infection, both a single one and the recurring kind. But what about getting ahead of the game? How can you be proactive and lower your risk to begin with? Let's talk about a few simple but powerful wellness steps. Honestly, these are small habits that can make a huge difference. Things like wearing breathable cotton underwear, or changing out of a wet swimsuit or sweaty gym clothes as soon as you can, because yeast loves those warm, moist environments. Even things like keeping an eye on your sugar intake, staying hydrated, and managing stress can help support your immune system and keep everything in balance down there. And all of this leads to a really powerful change in how we think about things. Instead of seeing a clinic as a place you only go when something is wrong, what if we started thinking of it as a wellness tool, a resource you can use not just to get better, but to stay well? So I'll just leave you with this question to chew on. When you know that fast, effective, and non-judgmental help is right there, maybe it is time to start thinking about healthcare differently. Not just as a reaction to a problem, but as a proactive, empowering part of taking care of yourself.